Yeah, so yeah, we'll just go through this for 15 minutes before the guys come who are presenting about fibroids, endometriosis, adenomyosis, and how to treat it. So we take infection prevention for granted, really, and it's sad. Um, when we come to a hospital setting, it's really an infectious place. Come in, come in. Yeah, we are waiting for you. Yeah, it's really an infectious place. So if we are not careful, we end up getting infection from the hospital to our families and so on. So it's something that we have to be conscious about. Everything we see, everything we touch in the hospital is infectious. The place where you're sitting is infectious because somebody came from surgery and sat where you're sitting. The rails, when you are moving over the stairs, you are holding the rails. All that is infectious. There's a patient with TB, there's a patient with cholera who touched all that. And we keep just being casual like that. So we have to think about infection prevention as you protecting yourself, you protecting your family, you protecting the patient, and other people that you're with. So this is just what I've just said, that the hospital is a very infectious place and we need to be aware that it's infectious. And the reasons why we need to be aware of that is just what I've said. You want to protect your colleagues, you want to protect your family, you want to protect your girlfriend. Yeah, because if you get an infection here, then you take it wherever and whoever you interact with. So I've already made this point that everything and everyone in the hospital is supposed to be treated as infectious, and that's an extension of you protecting yourself. How many vaccinations do you have? Have you been vaccinated against COVID? Have you been vaccinated against hepatitis B? Have you gotten all the vaccinations? Um, when I worked in Mansa, we had a lot of interns get TB, at a very funny TB word. Yeah, they got TB. Even some students got infection from the word. So we need to be aware of all the vaccinations that we need to get to protect ourselves. The other thing is about knowing like a part of protecting yourself is knowing what to do when you have an accident, when you have a needle prick, when you have liquor splashing in your eyes. What do you do? What are the steps? That is part of protecting ourselves. So this is what this slide is about. I hope everyone, all the students know, once you get a liquor splash, once you get a needle stick, you know exactly who to call, where to go. That is very important. What I can say from here is that just call whoever is most senior where you are. They'll probably get blood from you. They know how to quickly get some tests from the lab. They know where the post-exposure prophylaxis drugs are, and so on. Because you are new, especially students, you don't know where everything is. So just get the most senior person and tell them. Most of us get into the habit of getting a needle prick and ignoring it, or a liquor splash in your mouth and you ignore it, because you have maybe you've seen and you don't want to go through all that process. You just ignore it. I think we need to take it seriously and get these things done. Yeah, so this is just the same about protecting ourselves, about how our attire should match our job. We are very casual. Our attire should match our job. Where there should be a cape, there should be a cape. Where you should have goggles, you should have goggles. Where you should have a mask, you should have a mask. Your shoes should be all closed. They shouldn't have holes in them. You see doctors, registrars too, with shoes with holes in them on the labor ward. Those slippers they are wearing. When blood splashes, liquor goes straight into your shoes, into your socks. So that is critical as well. What kind of attire do you have? Because ideally we are supposed to have a different attire for the hospital and a different attire for home. So I'm not supposed to have this jacket in the hospital and the same jacket at home, because I've interacted with patients. So ideally you have a different attire when you come in and a different attire when you go out. So you've seen some good places that just when you're entering, you have to change. You leave your clothes in a change room, you put on something else, then you enter the hospital. And then you wear hospital clothes. Once you wear those hospital clothes, you work that day. When going out, you remove your hospital clothes, throw them in the bin. It has your name on it. Somebody else washes it. And the next morning you find things washed that you wear when you get into the hospital again. That's what our friends are doing. And I don't know when we get to that point, but it's important to be aware that infection is real and it can be spread to other people, and our attire should match what we are exactly doing. Hand washing, you need to know how to hand wash properly. I think you just have to Google your CDC video, WHO on how to wash your hands before you touch a patient. That we all know. And then this is called the 5 hand moments of hygiene. There are 5 points when you're on the ward that you're supposed to wash your hands. So again, just look up these 5 moments. Before you touch a patient, before having an aseptic procedure, you're supposed to wash your hands in the way the previous slide showed. After touching or exposure to fluids, you're supposed to wash your hands. So we lift up urine bags all the time to check the amount. So some of us just lift it up and put it down and continue with our lives. Some of us touch the bed where the patient is sitting without washing our hands. Some of us touch the files of the patient without us washing our hands. All those are moments that you are having contact or potential contact with fluids of the patient. Yeah. So we need to remember that, and we've already talked after touching a patient and patient surroundings. That has been talked about already. So just be aware of those moments of hygiene. We need to know how to dispose of waste. In our wards, we have a 3-bucket system. We have a yellow bucket, we have a black bucket, and we have a red one. So some places have a 4-bucket system, but what we have is a 3-bucket system. So you know that infectious waste kind of goes in the yellow bin, sharps go in the red one, or the sharp box in our setup, and the black one gets what is called domestic waste. Domestic waste is domestic waste because that's what the council comes to pick up. So the things that go in the black bin, the council comes to pick it up. It goes and they throw it wherever the rubbish dumping sites are in Lusaka. The things in the yellow thing go to the incinerator. You've seen the incinerator there with smoke. That's where things go. So we need to throw things in the correct places. The things in the black thing go in the community. So you can't put sharps there. When I was a child, I remember I go to a rubbish dump and find needles and I start playing with the needles and so on. Yeah, so needles shouldn't be in the domestic waste side. How are you, sir?
Fine, and how are you?
I hope we are not colliding.
Yes, we are.
We are colliding.
Yes, because I didn't receive your booking.
Oh, okay. So we have some pharmaceutical company presenting
it's the same
from
thing.
11:15. Is it the same thing you're coming for?
Yes.
Okay, then we are on the same page because they said they'll come at 11:15.
Oh, okay.
Yeah, yeah. Okay, so that's that. And they're already here, so that's fine. So we just have 5 minutes. So this is that. Then the instruments you use on the ward. You have 3 types of instruments. You have critical instruments, semi-critical instruments, and non-critical instruments. So your critical instruments are the instruments that go in the sterile spaces of the patients. So those instruments have to be sterilized before use. The non-critical instruments are instruments that have contact with intact skin. So those can be, you can like low level disinfect them. Then the semi-critical instruments are those instruments you are using on non-intact skin or intact mucous membranes. So those can be high level disinfected. So those are like the examples there. So that's just what we're talking about. Before you, that's like how instruments that are going to be reused on a patient are processed. First, you decontaminate. Decontaminating is really reducing the microbial burden on an instrument so that it's safe for cleaning. Cleaning technically means removing visible dirt on an instrument. That's what it technically means. So you are removing blood, you are removing tissue on an instrument. That is what is called cleaning. Decontamination is really you reducing the microbial load on an instrument so that the one who's cleaning, just imagine you are cleaning a tenaculum. A tenaculum is sharp. So if that instrument hasn't been decontaminated and it pricks the one who's cleaning, then they're in trouble. So you kind of reduce the microbial load before somebody actually cleans it. And then you decide, am I going to high level disinfect this instrument, or am I going to sterilize it? That depends on the use. So is it going to be used in sterile areas? Then it should be sterilized. Is it going to be used in mucous membranes? Then you just high level disinfect it, and the methods are there for. So the non-critical instruments, usually we just, your stethoscope, because they are on intact skin, you just wipe them with spirit, 70% alcohol. That's enough. Yeah. So generally that's about basics of infection prevention. You can read more about it and get some information, because infection prevention is important. Like I introduced, you don't want to infect your family, your baby. You are walking in labor ward, your shoe stepped on liquor, your child gets it and starts eating the shoe. Those things happen, so we need to be just careful about that. So I think that was it. There are no questions allowed because it's almost 11:15 and the team is already here to present to us. Thank you so much, and we will see you next time.